Patricia, this is the very first patient-led CAT question, I believe. So what brought the topic to mind, and how did you go about starting the process?
Well, a patient-led question was something that was discussed and approved, and my original idea for a question was to explore PPI involvement in the CAT process and whether or not it was beneficial. As it was felt unlikely to return much evidence due to the newness of PPI involvement, a more general health-related question would help me to understand and learn how the CAT process works. So I chose to use a health problem that I had been experiencing myself and would benefit me. So, having experienced shoulder pain for some time, an important factor in daily management was relief from fairly severe pain. Medication gave temporary relief, but mobility remained difficult. Following advice and instruction from a physiotherapist, exercises prescribed to me were carried out at home, and the benefit of pain relief and greater flexibility became apparent quite quickly. I posed this question as I was interested to see if there was any robust evidence which would support my experience. So the title was, In Adults with Chronic Shoulder Pain, do exercises prescribed by a physiotherapist help to reduce pain when compared to those who do not receive exercise?
So were you surprised at the level of detail, or in fact maybe the lack of evidence that you uncovered during this investigation?
Well, I attended several meetings with Kay and Tina introducing and explaining the CAT process. I was surprised at the level of detail required to extract the relevant evidence to answer the question adequately and precisely to achieve a strong result. We followed the CAT process together and retrieved evidence which would answer my question. I tested the question myself and with the advice of a physiotherapist and found exercise to be beneficial in reducing pain.
So will your findings now lead to greater patient and public involvement in a CAT, perhaps? And how could these opportunities for involvement be increased?
Well, what came back from research was, and I quote, there is strong evidence from recent systematic and guideline reviews that exercise reduces shoulder pain, suggesting that exercise delivered individually by a physiotherapist or exercise delivered in a group or exercises delivered in a supported home exercise program are equally effective in reducing pain in those with subacromial pain. I tested the evidence myself, which I found challenging both mentally and physically, but nevertheless really helpful. Following the advice of a physiotherapist, I found exercise to be beneficial in reducing pain. I was pleased with the result and excited for the future of patient-led CAT questions. But what is needed is greater and far more involvement by patients and public.
So maybe that is the next CAT question, how to promote patient and public involvement in the CAT process. Yes?
Yes.
Let's go for it.